Hello, everyone. My name is Abraham Umo, and today I'm going to be talking about clinical validation of the SCOPE hybrid model prediction of left ventricular assist device patient hemodynamics in 3 patient-specific cases. The physiology simulation coupled experiment framework is a hybrid modeling framework that couples a lumped parameter network simulation, known as an LPN for short, to a physical experiment, essentially achieving a closed loop feedback between the simulated physiology in the LPN and fluid dynamics in the modeled experiment. Previously, we verified the modeling capabilities of the SCOPE framework by establishing its correspondence with a computational fluid dynamics standard when both approaches were used to model a Fontaine graft obstruction in the cavo-pulmonary pathway. But we never really established the practicality of using SCOPE for in vivo clinical predictions. So in this study, we aim to achieve that by validating SCOPE predictions of post-surgical physiology following a HeartMate 3 implantation against clinical data. We begin by acquiring perioperative clinical data for 3 heart failure patients, characterized by the parameters shown here on the slide. Now, this clinical data essentially captures the hemodynamics of these patients before and after implantation of the LVAD. Once we acquire this clinical data, we then conduct some statistical analysis to characterize the pre and post implant hemodynamics of each patient. We then use the characterized pre implant hemodynamics to tune the LPN shown here on this slide to generate 3 corresponding digital twins. These digital twins are essentially LPN simulations whose hemodynamic outputs, specifically the parameters shown here on the slide, match clinically characterized pre-implant hemodynamics for each patient. In other words, they're essentially a virtual replica of each patient. Once we have these digital twins, we then use the SCOPE framework to virtually implant a physical HeartMate 3 via this flow loop experiments shown in this dashed blue box here inside the digital twins LPN simulation. The outcome of this is a SCOPE hybrid model that estimates post-surgical physiology for hemodynamic parameters such as cardiac outputs, central venous pressure, aortic pressure, pulmonary wedge pressure, and pulmonary arterial pressure. Once we have our SCOPE predictions, we compare them to our characterized post-implant clinical hemodynamics. The percentages shown here on the screen are the difference between SCOPE and clinical hemodynamics, essentially serving as our validation residuals. The goal is to minimize these residuals. Overall, for all parameters and all patients, our validation residuals range from 0% to 44.7%, illustrating the potential utility of these score predictions in a real-world clinical scenario. Now, you might be wondering what the clinical significance of these SCOPE predictions are. Based off our conversations with our clinical collaborators, we understand that the primary concern is being able to anticipate post-implant right ventricular failure. In many instances, after the LVAD is implanted in the patient, the right ventricle begins to fail. Now, post-implant right ventricular failure can be characterized hemodynamically by elevated central venous pressures, lowered cardiac outputs, lowered pulmonary arterial pulsatility index, and increased central venous pressure to pulmonary arterial wedge pressure ratios, all of which can be predicted by our SCOPE models. Now, focusing on our 3 patients in this study, we utilized a right ventricular diagnostic criteria of central venous pressure above 60 millimeters mercury and cardiac index less than 2.2 occurring at the same time. Using this criteria, our SCOPE models accurately predicted the absence of post-implant right ventricular failure for all 3 patients. We believe this demonstrates the potential for SCOPE-guided surgical planning optimization for improved patient outcomes. Thank you for listening to this presentation and have a wonderful day. Goodbye.